Rates of RSV, or respiratory syncytial virus, have been surging since August. That's weeks earlier than the typical season.
Pediatric hospitals are pretty stretched right now.
So doctors are warning of a possible
triple-demic. That means cases of COVID, flu, and RSV, a virus that's been impacting children, are all expected to rise.
Here's what to know about the surge in RSV and what it means for your winter. RSV is a virus spread through droplets from coughing and sneezing and on surfaces. It's so common that nearly all children come in contact with the virus by the age of 2. And while RSV feels like a cold for most people, it can be severe for some infants and older adults. According to the CDC, about 58,000 children under 5 are hospitalized due to RSV every year. In pre-COVID times, hospitalizations looked like this, peaking in January. But in the first year of the pandemic, RSV rates flattened. That's because COVID safety measures like distancing and face masks also likely protected people from other diseases. But around the summer of 2021, cases of RSV shot up.
Once you sort of start mingling again and dropping those restrictions, you get a lot of cases happening at once.
There's no approved vaccine for RSV, and children who didn't get sick from the virus in 2020 or 2021 might have less immunity protection. And for this fall surge,
there's a couple things at play here. One of them sort of being that a lot of kids have gone back to school in the fall. And this year, there was significantly less masking in a lot of schools and other safety precautions that there were for the past 2 years. There's been less exposure. Some of the tiniest kids haven't seen RSV before, and so you have sort of a higher susceptible population among sort of the youngest.
This surge in RSV comes at a time when other respiratory illnesses, like the rhinovirus and enteroviruses, have increased hospitalizations in children. So doctors are bracing for more cases.
The Connecticut Children's Medical Center in Hartford is considering setting up a field hospital in case things get worse.
And some physicians are worried about precautionary measures for high-risk infants.
Vulnerable babies, as a precaution, get injections of this monoclonal antibody during the normal respiratory season. But if, RSV strikes earlier or during the summer, a lot of those babies, unless hospitals sort of can anticipate and keep up quickly, sort of lose that extra protection.
It's not just RSV. The flu season arrived earlier than usual this year, too.
There is a lack of exposure because less people have had it for the past 2 seasons. Lower vaccination rates because, that's a sort of a better way to build up exposure. Less precautions as people are heading inside and into schools and workplaces again.
And that, combined with a possible uptick in COVID cases, has doctors worried about a triple threat of RSV, COVID, and flu.
A confluence of all of these viruses could put hospitals under serious strain this winter, because for the last 2 winters, hospitals were completely slammed entirely just with COVID. What we saw during the pandemic is that if a hospital is overrun, it's harder to get in for any other sort of care that you might need. An overwhelmed hospital isn't good for anybody.
To help reduce hospital capacity, health officials are encouraging people to get their flu and COVID vaccines.